I think about palliative care as a specialty, like many other specialties. I compare it often to a specialty just like cardiologists are specialists of the heart and the cardiovascular system, and neurologists are specialists of the brain and the central nervous system. Palliative care, we are the specialists of comfort, quality of life, and who doesn't deserve and want that for any point of their life, really. So especially when we are burdened with other, major illnesses going on. So when I think about palliative care as a specialty, one of the things that makes me the most excited about it is I feel like we have endless possibilities still of what we can do with this specialty. I've had some really unique conversations with people who've been in the space for a long time, watching and hearing and learning from their experiences, especially like a pre-COVID conversation. I really think palliative care found its place of importance through the COVID tragedy. Really more than ever, we started talking more about what is quality of life, what is comfort, what is, how do we be proactive in a space where we're left in this kind of aftermath of having to be reactive to this major illness that kind of swept the world. And so, here we are, 2026, only 6 years post-COVID, and we've seen so much growth and change and understanding in a different way of what palliative care really can offer the whole healthcare space. And we have so much more to go in terms of what we can really do in helping people see that, yes, there are these options for curative measures, and there's these options for interventions, and there's also the question of, and what after that? What next, right? And I think sometimes we forget to ask that. I find myself as a patient forgetting to ask that sometimes. You have this thing happen, you get told like, well, this is what we should do. And then we say, okay, yeah, go ahead and do that. And then the conversation of, but then what after that, right? And I don't know that we need to be 20 steps ahead of ourselves, because we probably just get, too overwhelmed and too anxious and too worried. But I think it's fair for us to try to think at least one step ahead of ourselves. This is what we're dealing with right now for our health. But then what's the one step after that? What would be the next thing that I should be anticipating? And to me, that's where all of the, there's so much room for palliative care to fill into that space, is what's next? And is this, are there alternate options besides the one that was mentioned? I can do this, and what's the option if I don't do that? What's the next option? Because we should be able to be offering and educating our patients to more than one choice, so that they have their full spectrum of informed, care, and they can make really good quality decisions that are in line with their goals.